I'm going to try to focus on two topics, and the topics are going to be kind of our current state within the city here, and also I think what's more important, and I think what's more on people's minds right now is specifically the bylaw. So I want to talk about that, spend some time answering some questions about that, and maybe clearing up some misconception, also trying to send a message as it relates to the bylaw. And one thing that I don't want to focus on, and I spoke about this during open council last night and tried to, I'll call it, paint a bit of a picture as to what was occurring in the province. And I think we can all see it. We all hear it within just even local media and media in other, I guess, cities regarding what kind of that current state is provincially, and it's not good. And we're waiting to see kind of what occurs from the province as it relates to increased counts. And I think the public's waiting, we're waiting, nobody else is waiting, or everybody else is waiting. So I don't want to really focus on that. It's a bit of a grim story. Our current cases, though, like I'd mentioned last night, we're sitting at 92 cases, and I want to really start off by saying the decrease in the cases. So we were roughly, believe we were actually over 110 cases there less than a week ago. We've come down to that 92. All of this is based on, I guess, good decision making, that responsible decision making that we continue to talk about. All of this is within our full control within this process. One thing that really kind of struck a nerve with me last night is one of the questions that we received from one of our council members, and that was Councillor McIntosh. And what he had asked was changing some of the messaging to be maybe some, a light at the end of the tunnel or some good news. And that, like I said, that really struck a nerve for me. And that is important to talk about. And I don't know if, people that are perhaps watching this or, anybody else that may come across these videos in the future, but there is now formalized plans in place, both from a federal perspective and a provincial perspective, as to how this is actually going to come to an end, or hopefully come to an end, related to some of the vaccine programs, so the provincial vaccine task force and obviously the federal provision of those vaccines. And in emergency management, we always are taught that every event will come to an end at some point. Regardless of what you do as it relates to actions, it will come to an end at some point. Now, how it comes to an end is up to us and is within our control, is based on how long that occurs, meaning how long that event actually is. But I think more importantly is to how severe the outcome actually is. And so all throughout this process, throughout the past eight months, 9 months, even going on 10 months here, is all about decreasing the severity and the impact of this. We all recognize that this was going to come to an end at some point. And I think we all know the term now, which is known as herd immunity. That's not the optimal way, because you have the severity is very, very high. But all of these items that we're doing here are actions that we can put in place to decrease the severity. And so I wanted to really talk about kind of current state here, and the fact that we're a little bit opposite as to what's occurring with the province or with the rest of the province. Is we're decreasing and the rest of the province is increasing. And I shouldn't say the rest of the province, it's more so the central to the north side. And so we do have an end in sight. We are decreasing as residents, meaning active cases within the city. So let's keep it that way. And I know I'm going to speak on the face coverings bylaw here in a moment. But the face covering bylaw is just one method. It doesn't mean to say that we're all going to wear our masks and then that's all that we have to do. So everything that we do to decrease these case counts and actually keep the case counts low is within our full control. And so I just wanted to reiterate that and essentially congratulate and applaud the public for bringing those case counts down, because it was everybody out there that's doing this. It's not me, it is everybody out there. And one other item that I wanted to speak about with the current state is the holiday season that's coming up. And so we saw what happened in Thanksgiving, or following Thanksgiving, is we had that exponential increase, and we have another probably even larger holiday season coming up. And so what we don't want to see is either that same or even a higher exponential increase as to what we saw during Thanksgiving. And we have the ability to influence that, all of us, myself included, have the ability to influence where those case counts go. They can either go up or they can go down. That's all up to us. And the reason why I say that is all up to us is because when I go back to our face coverings bylaw, our face coverings bylaw don't take into account somebody's home. So if you bring in all of your family members and have your holiday get together, that is your choice. And I also do want to reiterate the fact that with bringing people into your houses, there currently, I'm not going to say there would be an order for that in the holiday season, specifically around December 25th there. But currently there is actually a Chief Medical Officer of Health order to state that that can't occur. So therefore it's technically enforceable related to having people in your home. Now there are some stipulations around that. There are some exceptions regarding, caregivers and maintenance personnel, and even some different other exceptions related to if you do live alone. So I encourage the public to educate themselves regarding some of those orders that are in place. It is enforceable. Keep in mind, as a municipality and within our own police service, we are very much education-based. Some other municipalities, keep in mind, that are seeing a far, far higher spike and far higher increase are starting to move away from that education and moving more to an enforcement. We don't see a need for that right now. Our cases are decreasing, and we never ever wanted to get to the point where we were getting into enforcement and hard enforcement, meaning ticketing, fines, and the like. So I just wanted to reiterate that one, and the fact that that is completely under our control. So as a local authority, and even within my position as Director of Emergency Management, I can't influence that. I can't control what you specifically do within your home and how that occurs as to when you bring people into your home. So that is under everybody's control, including myself as just a resident within the city. So I wanted to kind of reiterate that piece. The second piece that I wanted to talk about is the face covering bylaw. And two things is questions that we've been receiving, and also I'll call it maybe concerning events that have occurred even prior to the implementation of the face covering or bylaw as to what's occurring. And I just wanted to touch on that, or not touch on that one, but really almost focus on that one. So face covering bylaw, so it came into force on Friday. And so there are additional measures specifically for businesses that come into force December 11th, specifically related to signage, but even just my observations across the city is that's already taking place. Feedback both from residents and businesses has been positive as it relates to, or generally positive as it relates to the decision made by our council to actually put that bylaw in force. But questions are going to come up. That's expected. And I think everybody knows we're not the first one to implement a face coverings bylaw. Numerous municipalities within Alberta have done this before us. They ran into this situation before as well. Lots of questions, lots of confusion, and that's okay. We're fielding questions from businesses and even internally as to how we start to apply certain stipulations associated with this. We can't outline in a bylaw every single possible scenario. That's what we don't want to do, because we want to keep a bylaw so it's somewhat, it keeps the spirit of a message around face covering use and why it's required. And we also don't want a bylaw that's that thick, outlining every specific scenario. And so if you do have a question related to the face covering bylaw, the first place and really the place to go is our FAQ page, our frequently asked questions page on the city website. Is we continue almost on a daily basis, continue to add frequently asked questions on that page, and we recognize that there's going to be questions, and like I said, that's okay. And in fact, questions are good. It's positive when we start to see questions, because it tells us that people are trying to apply it. Businesses are trying to apply it. There's compliance that's wanted. Everybody wants to do the right thing. And I mentioned this even at Open Council last night when I was asked by, I believe it was Councillor Dumanowski was asking, what are the types of questions I've been receiving lately? And it has changed throughout the course of the pandemic, but right now we're seeing questions as to what can we do? How can we apply this? What can we do better? That makes me smile whenever we start to receive those questions, because that tells me, like I said, that compliance is the goal. And I don't even want to say compliance with, from a regulatory perspective, but just doing the right thing. We all want to do it. The second piece that I wanted to talk about specifically within the face covering bylaw is some of the maybe the background or behind the scenes concerning things that we're seeing. And we're actually seeing it from two sides. So it's maybe I'll call it perhaps disrespectful behavior. The individual may have an exemption based on human rights legislation, and where that comes down to is if there is a medical exemption associated with that individual doesn't have to wear a face covering. We need to believe those people. We need to trust those people. Personally, I know somebody that can't wear a face covering based on a medical illness. And so I perhaps sympathize for this situation, because it can be difficult. I've had numerous conversations with this individual, and this person doesn't want to leave their house anymore, just given the fact of the kind of the backlash or the way that people look at them. And that kind of hurts my heart a little bit when I hear stuff like that. So that's just one side of it. So the other side of it is where the individuals that may not necessarily believe in masks or feel that they're needed, and portraying that disrespect for negative behavior on somebody that may be wearing a mask. So we're actually seeing right now from both sides. And so again, I'm gonna say the same thing associated with that, or reiterate that same message: is it's not necessary. And I'm gonna kind of conclude this discussion with repeating something that Mayor Clugston had said. This was he started coining this phrase roughly about 6 or 7 months ago, and I think we need to bring it back. And it really strikes a bit of a chord, specifically with this situation. It uses the 4 C's. Those 4 C's is we need to be calm, we need to be courteous, we need to be cautious, and we need to be compassionate. And I can't think of a better phrase right now than those 4 C's. So even think about being courteous and compassionate. That right now is the way that we need to act associated with the face covering bylaw. Face covering bylaw is just one additional tool. It is not the tool. It is not the only thing that is going to decrease cases or keep our cases static. It is just one tool. Again, with an emergency management, we have numerous strategies that we use. We hope some of them work. We hope that they all tend to layer together. But this is just one tool. So we still have physical distancing. We still have sanitizing. All of those still apply, and all of those are just as important as any other one of those. And so those 4 C's: calm, cautious, courteous, and compassionate. And I encourage everybody to really think about that, really take that to heart on the fact of you don't know what that other person is going through, let's say, if they're not wearing a mask. You don't know what type of, medical illness they have. And so please, I plead to the community on this one, is we don't need to act like this. We've gone through enough. This is the last thing that we need right now, is now for this disrespectful behavior to come out. I've even heard of people just even over the weekend of, taking a cup of coffee and throwing it on people. I have to cock my head a little bit and go, why? Why do we have to behave like that? That is unacceptable. And so please practice a little bit of compassion associated with this. And so the question was, associated with some of this disrespectful behavior, would the city consider using the anti-bullying bylaw, which is actually our public safety bylaw that has a stipulation associated with bullying? And that's another tool within our toolbox as a city. I don't want to speak on behalf of by law enforcement and our police service, but at the same time, it is another method that we can use to stop this behavior. And so if this does continue, that could occur. But I plead to the community to just, we don't even want to get to that point. If we have to get to the point where we are ticketing somebody for bullying, we've gone way too far.